it pertains to your spine. So let's just talk about that for a second and establish what is it that we're talking about. What should the spine look like? And what are these curves we're talking about? So when we look at the spine, we have three curves really, okay? So we have a primary curve right here, and then secondary curves that form at the cervical spine here at the top, and the lumbar curve that happens at the lower half of the spine, so your low back area. Now, these curves actually are not by chance, they are absolutely by design. So when we're in utero, in the womb, we actually form that first curve, and that's in your mid-thoracic. So pretty much from the space at the bottom of your shoulder blades, all the way down to just at the bottom of your rib cage. So that curve develops first. And then as we go through life, any of you parents or people who've spent time around babies, you notice they start to crawl. So when they start to crawl, when this is flat, then we start to develop the lumbar spine curve. So as they begin to crawl and they go through that phase of life, we develop that low back curve. So crawling is important for so many reasons. We could get into that in a whole separate video, neurologically how important crawling is in tummy time, but we'll save that for another time. And then when we get to the upper neck, you notice babies when they start to crawl, really trying to be able to pick their heads up. So as we start to pick the head up, we actually get that cervical curve, which both of these curves, so by the time we get to adults, they should measure somewhere between 40 and 60 degrees. So, that's a pretty good significant, it's a C-shaped curve. And then the mid-back curves the other way, and then in the low back, that's another really important curve we want to have, and that measures somewhere between, normal would be somewhere in that 40 to 60 degree range. So quite a bit of curve. A lot of patients that we see come into the office, the clinic here, most of them have just suffered what I would call micro trauma, so small trauma to the spine, and usually that's the result of poor posture. So when we talk about restoring the curve and how curves are important, it plays a huge role into posture. So we want to preserve these dynamic curves in the spine, because with these curves, then the spine acts as a spring and coil, right? I think people are feeling the effects of that more now than ever. Part of that due to time we spend sitting, right? Where we're sitting in these positions and, we're on a computer and we're hunched forward, and we start to lose the curve in the upper neck, all right? So instead of the shoulders and ears being in line, we start to do this, lean forward. We get that turtleneck appearance. And really what's happening is then that spine is, instead of being up here, nice and curved, we start to bend that spine forward. And all of the reason these curves are so important is because we have constantly downward pressure on us, and that's due to gravity, right? So gravity is constantly pushing straight down. So when we have these dynamic curves of the spine, in the spine, we get that spring and coil. However, when we start to lose those curves, we get downward pressure that now is going into the spine, and it's not being absorbed. And because the heads come forward, we're actually increasing the effective head weight on not only the spine, the structure of the spine, but the muscles as well. So many times people are coming with really tight neck muscles and limited range of motion because these neck flexors in the front are getting just overworked all the time, and their extensors in the back are getting squeezed really tight. So they definitely go hand in hand when we talk about curves and preserving curves. And then a loss of curves, there's always a muscular component that's at play as well. So as our body adapts in structure, we adapt in muscle tonicity as well. So that's a huge part when we talk about restoring the curves. So one of the really exciting things at the office though is, and with chiropractic in general, there's many techniques. One is specific chiropractic biophysics, and they really focus on analyzing and using line analysis with digital x-ray and some other means and tests that they do to really calculate what degree of curve do we or do we not have. And most chiropractors, when you go in for an initial assessment, what we're assessing, if it's an office that has x-rays and they want to use them for either technique purposes or diagnosis purposes, we're able to measure all these curves in the spine. So really making sure that we do the proper analysis to see how we can improve the curves and help restore the curves. And we do that through a very low invasive method, which consists of chiropractic adjustments, where we can get into on a whole nother video. So many benefits scientifically, research is continuing to pour out and support as evidence for how chiropractic works. That's a huge part, is communicating that. But this is a primary area where we focus on, is not just adjusting you with neck or back pain, but how do we get these curves back in the spine and help restore? Because we know that as we have good structure in the spine, and really when we talk about the spine, it's all about the nervous system. All right, your central nervous system runs through the spine. The spine, the actual bony structures, are what encase, surround, and protect the spinal cord. So areas that the body needs a lot of protection, it lays down bone and has an intricate structure, such as the skull protecting the brain, and as is the case for the spine. The central nervous system runs through here. As you look at this spine from the side view, you can see all of these yellow little rubber cords that are coming out here, but those are actually signifying nerves. All right, so the central nervous system, the spinal cord, is encased in the spine, and then exiting at various levels are in between a disc and spinal levels. We have both a intravertebral foramen, which allows the nerve to pass through, and then of course the nerve itself. Those go out to various parts of the body that do not just facilitate movement, but these are the very nerves that connect directly to our heart, to our lungs, to our stomach. So there is so much more involved in how this structure, keeping it sound, is important. And by treating this and trying to restore curves and getting maximal amount of movement and allowing for optimal nerve flow, because there is no obstruction, or we're reducing obstruction and allowing for nerve flow to pass through more freely. That can manifest, of course, in neck and back pain being decreased, but even larger than that is improved nervous system function. We have so many miraculous stories and cases that come through the office as a result of treating the spine, right? That's what we do as chiropractors, is we treat the spine. As a result of that, of course, your nervous system has the potential to work better. And in that, we can see the body do what it's always been created to do, which is heal from within. So a lot of cool dialogue as we talk about restoring the curves, and some more content we'll get into later, but I hope this was beneficial. Again, we would love to, if you reach out to us, you can find us on our website, mychiroforkids.com. Check us out. Maybe you saw this on our Facebook. We'd love to get you into the office and do an assessment. We have no charge for the initial assessment, and that includes us evaluating if we do have a loss of curve, or if chiropractic is the right modality to try, and that's at our cost of expense. So would encourage you to get in for an assessment. If you can't come to our office, there's many great qualified chiropractors that can help. Thanks for tuning in, and we will see you guys next week.